Everyone.
Coming out of the woodwork.
My name is, for those of you who don't know who I am, my name is Christopher Dyer, and I'm a consultant with Whitman-Walker Health, and welcome to our community conversation. These are a series of regular conversations we have on a variety of health topics. This conversation is co-presented or co-sponsored by our friends at Mautner Project and SAGE and the DC Center. So we have four of us today. The purpose of these conversations is to talk about ways that we can improve health outcomes for the LGBT community. The topic tonight is older members of our community, hence having SAGE and Mautner and the Center be co-sponsors on this one. Our speakers and presenters will have insightful and fabulous presentations, and they will interrogate you. I should warn you, because this is a two-way conversation. So if you're shy, probably not the place to be, but I don't think any of you look shy. There are a couple of announcements related to some of our sponsors. Our good friends over at the DC Center want you to know that there's a Pride Month reception coming up, an evening on the rooftop of the residencies of Thomas Circle with beer, wine, and heavy hors d'oeuvres. This will be on Sunday, June 24th from 4 to 7. Check out the DC Center website for more information. Also, DC Center professional partner Bill Moran and the Shepard Moran Merrill Lynch team invite you to a reception and showing of the critically acclaimed film Gen Silent. Join us for cocktails and a showing of this award-winning film on Wednesday, May 23rd at 6:30 p.m. at the Bank of America DC Penthouse. Very snazzy if you've not been up there. Great views of the city. For more information, of course, visit the DC Center website. Again, this is a conversation. We're trying to figure out a way how to improve things. Courtney Williams is here from the DC Office of Aging. There's a survey that he's working on. They always seem to be asking us questions. So please see him afterwards to make sure the survey can get done, or we might even have copies of the survey in the numerous handouts that have been left for you on the table. And with that, I'll come back at the end to do some housekeeping. I'm now going to turn it over to our moderator, Joe Izzo from Whitman-Walker Health, and enjoy the conversation.
Good evening and welcome. Tonight is an opportunity for you to hear from three people who have some expertise in the field of aging. But more importantly, it's critical that we hear from you about issues that you're concerned about. So each presenter will have about 5 minutes to present after they're introduced, and then the floor will be open for you. And we will try to get you to generate as many questions, observations, or concerns that you have that we can feed back to our respective organizations, okay? Can everybody hear me? Mm-hmm. Yes, speaking loud enough. Okay, are we ready to launch this?
It's rock and roll.
Okay. Our first presenter will be Dr. Imani Woody, who has a PhD in Human Services, specializing in nonprofit management. Her thesis is entitled, Lift Every Voice, a qualitative exploration of ageism and heterosexism as experienced by older African American lesbian women and gay males when addressing social services needs. Now you have to be intelligent to remember a title that long. Imani is currently working as a diversity consultant, working in the field of aging and issues affecting the LGBT and people of color communities. As the Director of Client Services at the Mautner Project for Lesbians with Cancer, Dr. Woody managed programs that provided educational and direct services to lesbians and bisexual women with cancer. She was also the program manager for the National Caucus and Center on Black Aged, working on the national health programs to educate elderly African American women. Formerly a training specialist for the AARP's foundation, Dr. Woody developed curriculum and delivery of on-site and web-based trainings. Formerly a co-chair of PRISM, AARP's ERG group, Imani worked to help form the Washington, D.C. Elder Coalition. Dr. Imani Woody has been an advocate of women, people of color, and LGBT issues for more than 20 years and has served on the board of directors of the Mautner Project, Women in the Life Association, and Whitman-Walker Lesbian Services. She currently is the vice chair of SAGE Metro DC and chair. You're not in charge of vice. No vice chair.
Not anymore.
No forget the vice. She's the chair of the SAGE Metro DC an organization serving LGBT elders, and sits on the board of the Metropolitan Community Churches of Washington, D.C., and is the ministry leader for its older adults ministry. Recently, Dr. Woody attended the first ever White House LGBT conference on health and participated in the lesbian health subgroup. She also attended the very first HUD LGBT conference. Dr. Woody lives with her partner of 12 years in Brookland, Washington, D.C., my humble neighborhood. We're neighbors. And she's going to address, well, she's got a little exercise for you all, and she will be addressing issues around oppression of minority peoples, including older folks. Imani?
Joe. You know I paid Joe, right, to say all of that, right? Thank you, Joe. Appreciate it. So I'm Imani Woody, and I've been working in this field for over 20 years, and I've become more passionate as the older I get, because we're talking about older adults, and I'm not going to say I'm an older adult yet, but I sure am treading on that, right? So that's where my passion lies. We're going to start this out with an exercise that kind of goes into who you are. And so what I want you to do is to give me your name and your date and how old you are. And what this does, well, we'll talk about what it does once you do it. So I'll model it. My name is Imani Woody, and I am 60 years old. I'll take a
A
pause.
sexy sexagenarian.
All right, so we will start with,
Me?
yes.
My name is Ron Swanda. I'm 66.
All right.
I'm Bill Ampt. I'm 48.
I'm Joe Izzo, and I'm teetering on 64.
Tom Sullivan, I'm